What is fine needle aspiration? Fine needle aspiration is an office-based procedure where we use a very small needle and use an ultrasound to guide it into, say, the thyroid to suck out some cells in order to get a diagnosis of what that growth is. We can do this on masses in the parotid gland, within the neck, or even in the thyroid gland. Why this is useful is that you no longer need surgery to obtain a diagnosis about lesions that are often benign. For example, thyroid nodules, roughly 95% of the time, will be benign. So therefore, we can avoid surgery in 95% of people. Now, this procedure is relatively painless, very small pinprick on the skin, and that needle goes in and sucks out some cells. You don't need to stop your blood thinners for the procedure, you don't need to take any sedation or have anesthesia, and you can drive yourself home immediately. You can resume all full activities immediately after the procedure. Now, in the office, the results typically take about 7 to 10 days. Most of the time, I perform these biopsies with a pathologist on site. We have a unique relationship in our office with a mobile pathology team called Doctors Pathology. They provide on-site verification and adequacy of the biopsies to ensure that we have the accurate material and sufficient amounts of material to provide a diagnosis. In other places, and in previous places that I worked, we used to have a cytotechnician. This was a technician from the lab that came up and was supposed to verify that there were enough cells prior to finishing the biopsy to allow the pathologist then to go back and make a diagnosis. Even with them on site, I felt that my failure rate or inadequate cell rate was around 20%. With my current pathologists, it's far less than 1%. We perform over 200 of these a year, and I can't recall the last time we had a missed diagnosis. Now, the procedure's done very easily. When it comes to thyroid biopsies, we clean the skin with alcohol. I have a spray that makes the skin very cold, and then we use a needle, which is smaller than a blood draw needle, and insert it under ultrasound guidance into the thyroid nodule and pull out some of the cells. We then hand it to our pathologist, have them evaluate it and ensure that we have enough cells to call it a day. Sometimes they feel like they need additional cells for additional testing, and they'll tell us that on the spot and then give us an estimated time of when that result should be back, whether it'll be 1 week or longer if special tests are required. Same is true with neck masses. The needle is slightly larger, so we use numbing medicine in the skin, draw out some of the cells, and send it off for whatever tests needed to be done. Within just a few minutes, you're on your way and back to your normal activities for the rest of the day.